especially in the house, you are expected to prepare the medicine. You are, oh, I'm so sorry.
Ba't naka-learn mo? Ba't naka-learn mo?
Okay. So when you prepare the medicine, you give the medicine. Yes, caregiver can give medicine here in Malaysia. Here in Malaysia. In other countries, UK, Canada, US, this is depends, I can say depends on the policy of the agency. Depends on the nursing home, depends. Ang pagkakaalam ko, cannot, but depends. Hindi naman kasi ibig sabihin na when you in as a caregiver, lagi right kasi yan. Maybe when you in, of course, you will start from the bottom. When you work in a facility like nursing home in other countries, it is ladderized. It means, dito ka, because you're still starting, you have a senior, you have a nurse, you have a doctor. So you will be given a job description. Malay mo, when you in, you are at the bottom. Maybe mag-aral ka, you will level up. Level up. So you will still be able to use this. Because it doesn't mean that when you go in as a caregiver bottom, you will be like that forever. That is your choice. If you want to stay there, you have a choice to level up. And then, but even if you are not still in that level, here in Malaysia, when you're working in the house, you are the one who prepares the medicine. In other countries, even if you're working in the house, you alone with your caregiver, there is a nurse going in the house, she will be preparing the medicine. She's the one who top up it, she will give it, or maybe she will already give you the medicine for you to give for that breakfast, lunch, bar, or dinner. That is the protocol. But here in Malaysia, you will be the one to top up, and you will be the one to give, and you will be the one to assess your patient. How the medicine affect your patient. So that is how in Malaysia. That's why I'm teaching you all, because I know you're going to work here. Okay? So 10 rights of medicine is very, very, very important. So the first right, right drug. You must get the right drug. There is no reason that you're going to give the wrong drug. You must give the right drug, as simple as that. I don't have to explain. Right drug. Tamang gamot. Walang but, walang kama, period. Tamang gamot. Number 2, right patient. Tamang gamot. Mali ang uminom. Saan ang tama doon? Right drug. Number 2, right patient. Siguraduhin mo na tamang tao ang uminom. How you will know? Do not tell. Are you Mrs. Lau? No. What is your name, ma'am? What is your name, sir? What is your name, auntie? What is your name, uncle? But of course, if you are handling only one patient, you still need to ask. Sa araw-araw na ginawa ng Diyos, kayo lang dalawa ng pasyente mo sa kwarto. What is your name, auntie? Breakfast, lunch, what is your name, auntie? Bago ka magbigay ng gamot.
Exercise.
Kung okay ang pasyente mo, kung Alzheimer siya, matutuwa siya. Pero pag matino ang pasyente mo, baka hindi ka na umabot ng bukas. Pag Alzheimer lang, okay, matutuwa siya. Tanong ka ng tanong. Okay, so right patient. That is how you gonna silang bag-eggs. Okay, don't tell about your exam. Kasi basihan yan, medal yan. Silver gold, gold. Second patient.
Bigyan na lang tayo sa ini.
Okay. So, right patient. What you do? You ask the name. When you work in UK, Canada, not just one you're gonna ask. Not only the name you will ask. Hi, good morning.
You're so early for tomorrow.
So you're gonna ask not just the name, but you also ask what is your date of birth. Because some patients, pareho sila, especially sa Chinese. May iba, may kaika-iba. So you ask, what is your birthday? Tanungin mo yon if your patient is still cognitively capable. Ibig sabihin, alam niya pang mag-isip, alam niya pang sumagot. Huwag mong tanungin ng date of birth, yung Alzheimer mo, dementia mo, hindi ko titibigan, so hindi mo sabi sa akin yung parang birthday mo. Hindi mo sabihin mo, mali, hindi pwede. Kailangan talaga tama. So you have to know the disease of your patient, use your common sense. Koma si pasyente, paano mo tatanungin? Dementia, Alzheimer, hindi na nga niya alam ang nangyayari sa mundo. So tell me your name, your date of birth, then I give you your kids. If you cannot tell me wrong, cannot. Do not. Okay? So use your common sense. But this is, I'm telling, the proper way when you work in the nursing home in UK, Canada, when they are still able. You ask the name, what is your name? You ask what is your birthday. And then you can see also, they have a bracelet, ID band. Okay, they have an ID band in a standard setting. Okay? Number 3, right dose. Tamang gamot, tamang pasyente, overdose naman. Wrong. It must be right dose. You have to check 2 times, 3 times if you're giving the right dose. Minsan, sinasabi nila, same medicine. In the morning, 1 pill. In the evening, 2 tablets. So you have to be attentive to that. You always check yung order ng gamot, yung timing ng gamot, dosage ng gamot, ipadikit mo sa wall when you prepare the medication. So you can always see. Before you give, check again. Bilangin mo ulit. If you are not sure, do not give. If you are in doubt, do not give. You just give when you are confident. You just give when you know this is really the right dosage. And do not think that it's because it's small, the dosage is small. Wrong. Do not base on how the tablet, the pills looks like. You have to read what is the milligrams. You have to read the dosage. Do not assume. Okay, so do not assume. You have to read. Right number 4, right route. Yes, it is important. Right route is very important. Oral tablets. Example, as I said, when you give route, I will still discuss this in details later. When you say oral, there's liquid, there's tablets, there's capsules, there's buccal, there's the one you put in the cheek, there is sublingual under the tongue. Why is it important? It is very important because the drug is designed in that way. If you give the sublingual, pag sinabing under the tongue, pinalunok mo, binigyan mo ng water. Sabihin mo, gano'n din naman yun, sa bunganga. Wrong. There is a reason to that. When it says sublingual, under the tongue, under the tongue. When it says vocal, yung parang candy, you do it. When it says oral, need water, you give oral. It's because there are medicine why it should be under the tongue. Because under your tongue, if you can see your tongue, there are a lot of nerves. These nerves will deliver the medicine faster. Because when you take in your stomach, mahaba-haba pa yung biyahe na niya. Dadaan pa siya sa stomach, sa bituka, pinigil pa siya. But if the medicine is put under the tongue, it means most of the time these are emergency medications. It must take effect immediately. And they work, if you put under the tongue, matutunaw siya. Huwag mong ipalunok. Otherwise, it will not be effective, useless. And these drugs are controlled because most of these drugs are emergency drugs. Hindi siya Panadol ang level, ibang level. So pay attention to that. IV, I know you don't give IV, but I just mentioned that is one of the route. Yung ini-inject, yung sa dextrose, yung ganon, yung site, IV site is IV. Sub-Q, best example to that is when you give insulin. Yung sa tissue, yung sa taba-taba, yan ang sub-Q. IM is a muscle. You don't give that, but I just tell you that these are the routes of medication. And also, ilagay nyo din dyan yung rectal. You write rectal. For the enemas, for the suppository. Tingnan ko lang kung magpainom ng enema. Grabe na. Number 5, right time and frequency. So you really have to check the order. Why? Because, why important the right time? Because there are medication na yung side effect, dizziness, sleepiness. So those medications must be given in the night. Otherwise, matutumba si pasyente mo, hindi siya makalakad. Because you give the medicine in the morning, supposedly in the night. Ma-aksidente lang siya. And some medication cannot be given in the night because it can cause insomnia. Hindi natulog. Night shift si pasyente, damay-damay na. Kasi nagkamali ka, damay-damay na, hindi ka rin makakatulog. So you have to pay attention to the timing of the medication. If it's night, night. If it's bedtime, bedtime. If it's morning, morning. Because there is a reason why it has been ordered in that way. Hindi sa basta na lang. Frequency. It's how many times you're gonna give the medicine. My medication that they cut the dosage. 5 mg sa umaga, 10 sa gabi. It's like that. Why? There is a reason to that. Because these medicines, may timing siya. Ang medication kasi may peak ang through. Like, ang efficiency niya sa blood, nandun lang siya sa blood for 8 hours. Magpipeak siya ng 4 hours, tapos mawawala na siya. So it depends sa kailangan ng pasyente mo. So you have to follow the frequency. Nakalimutan ko rin ang umaga, mamaya ka din lang, tapos ilay ko. Hindi ko pwede. Hindi ko na pula. Pwede mo kasi makilang na gano'n. Mamaya ka din lang, tapos. No. You have to follow the frequency. The timing. Like how many times, what is the time it should be given. Actually, that is the 5 most. The 5 most. Dinagdagan nila ng 6 to 10 is because it is also very important. Number 6 is right documentation. Because by right, you have to document what you have given. In a professional way, in a legal way, you have to write down what you give. Hindi pwede yung, basta na lang yan, binigay ko na kasi yan, nakasulat din lang. You really have to document, especially when you want to work in a standard nursing facility, in a standard nursing home, you have to document. And also when you have a VIP patient, you have to document what you give. Anong oras, anong binigay mo, ilang dosage, you have to document. That is documentation. If pangarap nyo mag-level up yung sahod, then you will handle patients na mga VIP. They are very detailed. Hindi mo pwedeng sabihin, tapos na. You have to have your report. So write documentation. Yun ang isusulat mo. Huwag mo nang i-drawing yung gamot. Isulat mo na anong pangalan, dosage, anong oras mo binigay. Write history and assessment.
Ay, mamaya sa exam ha. Ay, may exam.
Actually, write history and assessment. This is not, you are not the first one who will do this. Actually, it's a nurse and a doctor in the hospital before they will prescribe the medication. But, if you are working as a private, ikaw lang at yung pasyente, you also must know when you bring your patient for checkup, may lagnat si pasyente, kilala mo si pasyente, mas kilala mo si pasyente. Mas kilala mo si pasyente, so when the doctor will give your patient is allergic to penicillin, nalagnat siya, pumunta kayo sa clinic, niresitahan siya ng amoxicillin, what you gonna do? You have to tell the doctor that your patient is allergic to penicillin. Do not keep quiet. Huwag na doktor yan, baka isipin pang sabihin niya, baka ma-epal ako, directionan ko siya. No, just tell nicely. By the way, doctor, my patient is allergic to penicillin. And they know what they're doing. And they will say thank you to you. Allergy can kill. I'm telling you. Allergy can kill. So that's why you have to know your patient history. Even if you're not a nurse, even if you're not a doctor, because you are with your patient and you know your patient well. Nurses and doctors come and go, but you will always be with your patient. So you have to pay attention to that. Kung anong bawal sa kanya, anong pwede sa kanya. Drug approach and right to refuse. Ito, hindi nyo na to sa cloud. This can do if the patient in the hospital, they refuse, they don't want to take, they will sign a waiver. I'm just telling you that it is included in the right drug administration. But I don't think that you will, okay, auntie, ayaw mo uminom, pumirma ka nito, ayaw mo uminom. I don't think that anybody have done that in the house. You will find a way how to make your patient take the medicine. Sumayaw ka, kumanta ka, lahat na. Papainom ko lang siya ng gano'n. Okay? Because it's in the house. Most of the time, we intend yung gano'n. This is just applicable in the hospital setting when they're giving really extreme medicines. Number 9, right drug-to-drug interaction and evaluation. Even if you're a caregiver, yes, you must evaluate. You are the one who gives the medicine. You have to see what is the reaction of your patient. Hindi mo pwedeng sabihin, ang doktor nagbigay niyan, ang doktor nagbigay niyan, hindi ako nag-order, naghihingalo si pasyente. You have to check the reaction of your patient. You have to monitor. Okay. Ito yung anti-hypertensive medicine niya. Binigyan siya nito. I will check the BP of my patient. Yung BP naging 70 na lang. Kung pababa. After 60 na lang. Wala. What are you gonna do? Report immediately. That's why you have to monitor. patient is taking antihypertensive medicine, so I will monitor the blood pressure. If you can see, you have to note your blood pressure for the next checkup. You have to make a note every day like this, you show to the doctor. So the doctor will know what to do for the next appointment. Oh, okay. Masyadong mababa yung BP niya. I will decrease the dosage. Like that. You just don't keep quiet. Hindi ka lang assistant security guard. You have to use your brain. You are a caregiver. So you have to write down your blood pressure monitoring, and then you bring it with you during checkups. Okay? But if it's already really, you know when it's not right, when it's going down, you do not wait for the next appointment. Of course, you have to call an ambulance. Baka mamatay si pasyente, wait ka pa ng check appointment. Okay, so you have to check. Number 10, right education and information. Right education and information about drug, actually it's not the caregiver, it's the nurse already who will educate the patient. This medicine is for this is the side effects of this is the job of the doctor and the nurse. But you are a caregiver, you are listening, you have to take note. So when you go home with your patient, you can remind your patient, Auntie, you have to take this medicine because this medicine is for this. If you will not take this, you will have dizziness. This is for vertigo. So you have, your patient will say, I don't want to take this medicine. I want to take tonight. And you know, the doctor already say when this medicine will be taken, the side effect is insomnia, cannot sleep. Your patient, mamaya na nga. Then you explain, Auntie, the doctor, the nurse said, this medicine must be taken in the morning, otherwise you cannot sleep in the night. So you just remind. It's your job. Okay? Hindi mo kailangan mag-research sa Google, humanap ng drug book. Gusto na, auntie, explain mo lahat. You don't have to do that. Okay? So that is the 10. Now in detail. Number 38. Page 38. Oral. Oral. So the drug is administered to or by way of the mouth. Drug via the route is absorbed into the systemic circulation from the GI or gastrointestinal tract. The oral route is the most frequently used route for drug administration. Yes, it is a very common route. This is intended for a patient who can ingest and tolerate oral medication. So only for patients who can swallow and who can tolerate oral medication. Those patients with NGP who cannot swallow, yes, you can still give the tablets and oral medication. You crush, you add water 10 ml, and then you can give. As long as it is ordered, oral medication. Okay? So you don't put in the mouth with a patient who got NGP. You have to give your medicine via NGP or via PEG. Even if it's written oral. Crush it, mix with water, mix nicely, then you put in the NGP. Oral dosage forms. So there are a few, as I said. Solid dosage forms, tablets. So my tablets, my immediate release, enteric-coated, modified release, capsules, granules, and powders. Ano po ma? Yung immediate release, most of the time, gabasan niyo yung Panadol Ordinary, Panadol Active Fast. Yan ang sample. This medication got their timing kung gaano sila kabilis to take effect. That is an example, as simple as that. So yung mga gamot na ganyan. So enteric-coated, best example of enteric-coated is yung pang-gastric, yung controlok, yung mga ganon na gamot. That they cannot be crushed. When you say enteric-coated, they cannot be crushed. It's because they are coated because when they touch directly to the acid of your stomach, they will lose the efficiency. So yung covering niya is to protect the medicine inside. Enteric-coated. Yan yung purpose niya. So by right, hindi mo talaga siya pwedeng i-crush pag enteric-coated. But here, I don't know, the doctor, my patient is in GT, my patient is PEG, still given with enteric-coated tablets, and I have no choice but to crush. So, like that. Modified release, capsules, capsules, granules, powders. Liquid dosage forms, syrups, elixirs, suspensions. Syrup, yung syrup, cough syrup. When they say elixirs, pag may alcohol. Pag yung mixture may alcohol, elixirs na siya. Yan lang yung kaibahan. Suspensions, naalala mo yung pinibigay sa baby? Liquid siya pero parang may powder. Yan ang suspension. Okay? Yan ang suspension. Yes, ini-shake mo. Then parang pa rin siyang liquid na siya pero parang tape. Kasi parang powder konti. Yan ang suspension. Elixir is yung gamot na may alcohol. Yung syrup, normal yung parang matamis-tamis lang. So advantages of oral, ease of administration, madaling ibigay, widespread acceptance, most of the patients are okay to take this. Cheap, mura siya compared sa other routes, generally safe route of drug administration, safe siya. Simple and convenient for the patient. Patient can self-administer, pwedeng ang pasyente mag-take. Non-invasive kasi hindi mo naman kailangang operahan yung pasyente mo para lang magbigay ka ng oral meds. Diba? Non-invasive. Disadvantages, drug absorption may vary. Ibig sabihin, pag oral ang binigay mo, hindi siya ganun kabilis mag-take effect. It will take 30 minutes to 1 hour. Kasi maraming mahaba-haba pa ang kanyang paglalakbay. That is the disadvantage. Pag may emergency ka, huwag mong ibigay oral. Patay na si pasyente bago pa mag-effect. That's why most emergency meds are given sublingual. So, kasi depende din kasi some patients, they have intestinal problem or gastric motility. Yung gastrointestinal motility. Yung paggalaw ng intestine nila, hindi masyadong magaling. So it will affect the absorption of the oral medicine. Gastric emptying rate, yung gano'n siya kabilis mag-process, minsan mabagal. May mga taong ganon. So pag may food, that's why when they say, take with empty stomach, that is before food. Before food. Half hour, 1 hour before meals. Ma'am, what if my situation talaga na after na siyang kumain, nakakain na siya paano? Don't worry when you say empty. Ilang oras matutunan yung pagkain mo? You give it 1 to 2 hours after the patient eats. When they say empty stomach. Halimbawa, there are situation na hindi dumating yung gamot. Huwag ka munang kumain, huwag ka munang kumain, may before food ka. Mahihimatay si pasyente. Hindi pwede kasi may empty. Eat this medicine, empty stomach. Huwag kang kumain. Namumutla na. You can let the patient eat. Give that medicine 1 to 2 hours after the meal. In any situation. Empty na yan. Okay? Pwede na lang kung pinakain mo ng buffet. Mahaba-haba yun. Okay? Hindi kaya na isang oras. Pagaling sa buffet. So, that's why, and there are medicines also that should be given with food. When meron, yes, especially when patients having pancreatic problem. Pancreatic enzymes, pancreatic enzymes should be given with food. Why not? Because it will be best, it will be absorbed best if it's with food. Pancreatic enzymes. So the technique is you always follow the doctor's order of the medicine. With food, without food, follow it. Okay? So, that is for medicine, empty stomach, before food, after food. Degradation of some drugs before reaching the site of absorption into the bloodstream. So that is a disadvantage again. Like, because dadaan pa siya sa stomach, mabahaba pa ang biyahe niya. So, konti na lang yung gamot na darating doon kung saan talaga siya dapat pumunta. Kasi naubos na siya sa biyahe niya. So that is one disadvantages of oral meds. Insolubility of many drugs at low pH levels is prevalent in the digestive tract. Because actually, acid helps the medication to break down. Saan lang yung acid? Sa stomach lang. Hindi lahat ng sa tiyan ay stomach. Tandaan niyo yan. Yung upper, yung dito, yan yung stomach. Then next to that is small intestine. Then you're gonna have large intestine. Sa large intestine, nabubuo ang tahi, hindi sa stomach, hindi sa small intestine. Remember that. Hindi na pagkain mo, tahi na agad. Dadaan siya sa stomach, acid, dadaan siya sa small intestine. Si small intestine, may kanya-kanya silang station. Akin na si vitamin C, akin na si sugar, akin na si kung ano pang pwede nilang kunin. Dadaan siya, pupunta siya sa large intestine, pababa. Ito ay hindi na to, basura na to. Yan na yung si tae. I don't need this. That is how amazing your body. You don't need to give them instruction. Ayusin nyo. They know what they're doing. They know what they're doing. So that is how. And pH levels, sa loob ng tiyan mo, iba-iba. Depending on saan part. Okay? So some drug, sensitive sila sa pH level. So yan din ang disadvantage pagka oral mo binigay. So the inactivation of the drug in the liver on its way to the systemic circulation. Because, class remember, anything you take, vitamins, organic to organic, yes, lahat kahit gano'n pa yan ka-organic 100%, kahit gano'n pa yan how you call this, original, your liver is the one who detoxify all this medicine, who breaks down and deliver it. That's why even if you're taking Panadol, your liver is the one who will suffer the most. Remember that. Lahat ng gamot, kahit gano'ng kagandang vitamins yan, it's your liver who will work for it. Hindi exempted porket organic, porket vitamins lang. Your body is working for that. So irritation of the mucous lining of the gastrointestinal tract. As I said, may mga gamot na oral, wala man silang dalang kutsilyo, pero kaya nilang sugatin ang intestine mo. Proven ko yan. There are medicines who can really harm your stomach. Hihiwain niya. An example to that, when your patient is having bleeding in the stomach, GI problem, sensitive, NSAIDs, ma'am, NSAIDs, non-steroidal anti-inflammatory drug. Ano yun, ma'am? Kalma. Mefenamic, constant, ibuprofen. Ano ba yung advertisement doon sa Pilipinas, yung sa tungkol, nagbabicycle si Lola at si Lolo. This is very good. Yung gamot na yun. Ano yun? Meron yun, nag-bisikleta na si Lola at si Lolo after nag-take yung mga gamot na yun. Pero ang alaksan ay brand name. Parang kasama din. Parang yun, na-percent. Yung nag-take si Lola at si Lolo, pwede na silang mag-bicycle. These medicines are very harmful to your skin. So that's why you have to eat before you take. Nag-prove ko yan. And always remember, these medicines do not take with steroid. Never take with prednisolone. Prednisolone is very cute, white, small, tablet, harmless. But if you take it with constant with mefenamic acid, good luck. I tried it. Hindi ka makakatayo sa sobrang sakit ng tiyan mo. Even if you eat, you cannot take these two together. And when you eat the NSAIDs, take the NSAIDs, eat first. Even if you eat, do not pair with steroid. Never, ever do that. Lucky I was still young that time. I tried. Try ko lang. Prove it. So that's how bad it is. Oral route not possible in unconscious patients. Logic, paano ka mag-oral unconscious na nga? Unsuitable in patients who are vomiting. Of course, when the patient vomiting, sino ka mo? Hindi kita ulit kasi nasuka mo. Iskibit. Wrong. When your patient is vomiting, do not give anything oral. Okay? Huwag kang mag-estimate. No. Huwag kang mag-assume. Estimate. Wow. Okay? Slow onset of action kasi mabagal talaga. It takes 30 minutes to 1 hour. The drug may be destroyed by digestive enzymes or stomach acid. As I've said, nagdurog-durog na siya doon. So yung purpose niya, mga 50% na lang dumating sa part na dapat siya pupunta. This is what I'm saying. Number 2, sublingual route. Sublingual is SL. If you see a medication with 2 letters, SL, that is sublingual. It means under the tongue. Under the tongue, huwag mo siyang bigyan ng tubig. It must be put under the tongue. Number 1, good example of that is glyceryl trinitrate or glycerin tablets, nitroglycerin tablets. That is for chest pain. If you're handling a patient with chest pain, cardiac problems, they will be given emergency meds. This medication is put in a colored container is because they cannot be exposed in the light. If they are exposed in the light, they will be not effective. So some of you may handle cases like this, and these are kept in a cupboard, cannot be exposed in heat or sunlight. This is nitroglycerin. When your patient is having chest pain, you will be taught you have to give under the tongue. You monitor your patient. Naninikip ang dibdib. It's given under the tongue. Observe for 5 minutes. If the patient is still in pain, masakit pa din, you really have to pay attention kasi pwede siya magka-cardiac arrest. After 5 minutes, you will be allowed to give 3 tablets of nitroglycerin in 5 minutes interval. But if the 1 tablet sublingual it didn't work, tumawag ka na ng ambulance. After 5 minutes, you give another medicine. Tumawag ka na ng ambulance. After 5 minutes, hindi pa, naninikip pa rin ang dibdib niya. Be safe. Call an ambulance. Then you give again your nitroglycerin under the tongue. Do not swallow. Okay? And there is also one example to that. Talk to breathe. Catapress. That is an emergency drug for very hypertensive patient. Nag-shoot up ang BP pagkataas-taas, 200 over 100, ma-stroke na to. So if the nurse, you will see they give under the tongue, that is anti-hypertensive medicine, that is emergency meds to make the BP down. Kasi emergency siya. So do not give water. So advantage, rapid drug absorption, quick onset, avoid first pass metabolism, kasi hindi na siya dadaan sa tiyan. Patient can self-administer, kaya ni patient, convenient, kasi sa ilalim lang ng dila. Can be quickly terminated by spitting out. Pwede niyang iluwak kung hindi na pwede. This route, kung i-stop na, this route can be used by people who have difficulty in swallowing tablets. It's because they don't need to swallow. Matutunaw lang siya. Advantage, that's our disadvantage. Disadvantages, most drugs are not available as a equal formulation. Hindi lahat ng gamot. That's why you don't see most of the drugs given sublingual. 40, page 40, the taste of the sublingual dosage form may not be liked by the patient. Minsan, kasi nga naman, ilang minutes siya nasa ilalim ng tongue. Placing the sublingual dosage under the tongue until it dissolves may be considered inconvenient for some patients. So some ayaw, minsan it irritates, because sometimes it's irritating, long time under the tongue, simply there. Buccal route, this is pag kumain ka ng candy, nilalagay mo sa cheek, that is buccal route. Placing the buccal dosage form between the gum and inner cheek. Parang candy. So you have to read your module. I want you to read it word by word. So buccal dosage forms. Yan yung mga gamot. Chewing gum, nicotine gum, ganyan. Buccal route, simple as that. Rapid drug absorption, avoid first pass kasi hindi na siya direct pupunta sa tiyan. Convenient for the patient, very easy lang para ka lang ng candy. Disadvantage, some maybe don't like the taste. Irritation of the oral mucosa. O nga na, kasi minsan irritating siya kasi matagal siya matunaw. Next is rectal route. Rectal, walang ibang daanan. Wait lang, pag sinabing rectal. So rectum. This route is useful for patients with GI motility problems such as dysphagia or ileus that can interfere with delivering the drug to the intestinal tract. So yung mga have difficulty of swallowing dysphagia or ileus, ibig sabihin yung stomach niya parang paralyzed, as simple as that. So hindi pwede yung gamot, useless na gamot pag ipatake mo oral. Kasi in short, parang half dead na yung intestine. It doesn't work well. So you're gonna put directly sa puwet. The rectal route is also often utilized in patients near the end of life undergoing hospice. Yung malapit ng mamatay, easy. Even sa paracetamol. Yes, there is a paracetamol suppository. Meron. Nabasa niyo, Panadol paracetamol. Nakita niyo, nakalagay doon ang sinabi, paracetamol suppository. Paracetamol. Huwag kang malito, baka ipakain mo. Ang sinulat doon ay suppository. Saan lang si suppository? Kahit Panadol pa yan yung pangalan. Huwag kang malito at mataranta. Kasi pagpapalitan mo, iniinom ka po yan. Ang suppository siya. Pag suppository, wait, kahit anong gamot, always remember that. Okay? It's very easy. Isasaksak mo lang sa puwet. These are most patients na yung mahirap tulog or yung pasyente tulog. It's very effective. How you gonna position your patient if you gonna insert suppository or enema? Sideline to where?
Left side.
Perfect. Sideline to the left. Advantages. Relatively large amount of the drug can be administered. Pwede. So those drugs destroyed with the acidic medium in the stomach and those metabolized by pancreatic enzymes can be administered effectively. So pwede siya kasi hindi na siya dadaan sa stomach, diretso na siya sa puwet. Safe and convenient, especially sa baby. Yung baby din, marami din silang paracetamol suppository. Kaya lang maliit yung kanila na dosage. Kasi mas madali siya kaysa sumisigaw-sigaw at 2 tao, 3 tao hahawak. So isang sak na lang sa puwet, mas madali. And then, used in emergency, yes, emergency. For seizures, I have a patient, merong mga ganyan for anti-seizure. Sa puwet dinadaan, the rate of absorption is uninfluenced by the ingestion of food. Hindi na siya maapektuhan kahit pakumain si pasyente pag sinaksak mo sa puwet. Hindi na yan siya maapektuhan kasi sa may ano na siya sa baba na. So it doesn't matter kung empty stomach ba, before food, walang ganon. Pag suppository at inima, wala siyang before meals, after meals, empty stomach, walang ganon na order. But of course, kung kakakain ng pasyente sa kanmo agad. Diba? So the patient can self-administer. Pwede. Of course, pwede. Pag okay si pasyente, pwede naman tayo. Of course. Alam ko, alam nyo, yung kagaya sa inyo, yung hindi makatay, alam ko, yung may nag-try na mga suppository. Hindi nyo kailangan ng ibang tao magsaksak. Kaya nyo, pag okay pa yung mga kamay nyo. Kaya yan. So, can be used in patients and able to swallow, vomiting, and conscious. Reduce first pass metabolism. Always first pass metabolism kasi hindi na talaga siya dumadaan sa stomach. Disadvantage, some hydrophilic drugs like antibiotics and peptide drugs are unsuitable for rectal administration and as they are not readily absorbed. Yes, hindi ko pa na-encounter sa buhay ko yung antibiotic via suppository. Wala. So not all drugs are made as suppository or enema. Some drugs can cause rectal irritation and proctitis. Some can, leading to ulceration and bleeding, especially yung enema. Yung tip na masyadong hard minsan, sa ilang beses mong sinasaksak, it can irritate, lalo na pag may hemorrhoid si pasyente. Uncomfortable and messy to use. Uncomfortable naman talaga. Minsan pag may diarrhea, paano? Hindi mo lalagyan na pag may diarrhea, paano na lang?
Sisirit.
Nagtatai, lalagyan mo pa rin ng suppository. Paano naman daw? Paano naman daw? So you cannot put anything, any medicine via suppository if your patient having diarrhea. Uncomfortable and messy, inconvenient for the patient, especially if your patient is still okay. Sino ba namang very willing sa inyo? Sige na, via suppository na lang. Siyempre, wala. Diba? Hindi talaga yan yung first choice. Hindi talaga. Especially pag okay si pasyente. Sinong pasyente very willing. Sige, balik mo na yung isaksak mo na. Walang pasyente mag-o-offer ng gano'n. Okay. Page 42. I don't want to read it word by word because it's your job to read. Okay? I'm here to explain. So, not well accepted by the patient. Parenteral route of medication, you don't give this. Most of the time, ang pwede lang sa inyo sub-Q, which is insulin pen. Kasi you will handle diabetic patients and you will be taught how to inject the insulin of your patients with the order of the doctor, with the timing given to you. So, hindi niya kailangan pumunta ng clinic o hospital para mag-inject with the use of insulin pen. So, that is sub-Q. So, you have to know this. But I will just mention about the IV and the IM. Just for the sake of knowing the fact na ito yung mga IV route. Okay? So, intravenous. Ito yung mag-inject. Dextrose, yan yung pinaka-common na word. But actually, it's IV fluid. Intravenous. Diretso sa vein. Injection. Pwede siyang inject. IM sub-Q, emulsion injection, solutions for injection, solutions for infusion. I don't have to be details on this because I know this is not your responsibility. Number one, you don't mix drugs in the vials, you don't mix drugs in the ampules, prepare this, you don't do that. Only yung insulin pen. So ang advantages talaga nito, I just mentioned a bit. Yes, this is suitable for emergency because this is really the best way to give emergency meds. That's why when the patient arrives in the ER, the first thing that the nurse will do, aside from checking the vital signs, is to put the line. Nagtatarantahan na yan. May nagkumukuha ng vital signs, may nag-i-insert. Ang purpose niyan, hindi talaga yung dextrose. It's the line. Because this way, we can save the patient. Inatake si patient, before siya atakihin, pwede na kami magbigay kagad ng gamot for that. This is the fastest and the best way to save the patient. That's why it doesn't matter anong sakit ng pasyente mo, when they arrive in the ER, it's protocol. Vital signs, IV line. Anything will happen, we can save the patient. That is the reason for that. Hindi yung tumutulong. Okay? That is how important the IV line. And of course, I don't have to read this. You read word by word because most is very simple. Phlebitis or extravasation, I want to emphasize this. Like this. It's your job when you work in the hospital, when you're a caregiver, your patient is admitted in the hospital, hindi porket may nurse o doktor, uupo-upo ka lang, wala kang sakit. You also have, your job is to monitor. Anything abnormal, anything unusual, report. Do not keep quiet. If you check, you touch the IV site, warm, hot, report. That is not okay. It is inflamed, that is phlebitis. When you see the word phlebitis, that is the one. Red, inflamed ang IV site. Pag sinabi naman, you write there, infiltration. IN. Beside that, you write IN. F. I. L. T. R. A. T. I. O. N. Infiltration. Again, infiltration. IN. F. I. L. T. R. A. T. I. O. N. Infiltration. That is the opposite of phlebitis. Mainit si phlebitis, si infiltration ay malamig. Understand that? I want you to see the difference. Pag mainit yung IV site, mainit na ang kamay ng pasyente mo, namamaga, that is phlebitis. Pag malamig, ganito, malamig yung IV site compared sa other parts, malamig, that is infiltration. Ang kaibahan. Pag infiltration, ibig sabihin, yung gamot ni pasyente, wala na siya sa vein. Dito na siya lumabas sa kamay, sa tissues. That is infiltration. That's why it's cold.
Ano yung mainit?
Okay?
Heart filtration.
Phlebitis and infiltration. See the difference? So pag masyadong mainit, pag masyadong malamig, kakaiba yung temperature, report. That is not okay. Do not keep quiet kahit hindi pa ikaw ang naglagay. Kahit sabihin mo pang caregiver lang ako, hindi na ako nurse. Yes, but it is your patient. You have to report. Infiltration, malamig. Phlebitis, mainit.
Phlebitis.
Phlebitis, basahin in terms of risk of phlebitis or extravasation.
Wait.
Saan ba yan? Phlebitis.
Sa page 43.
Asan ba? Three?
Tuloy dapat.
Rest, okay, binding.
Okay, move on na. IM, intramuscular route. Ito na yung simple. Nagpabakuna ka sa COVID. That is IM. Pag piniga yung braso mo, pag piniga yung legs mo at nag-inject, yan ay IM. Pwede with intramuscular. Pinipiga para pumunta talaga sa muscle. Sa muscle.
Tiga, tiga.
Kaya yung position ng kamay ni nurse parang dart. Pasok na pasok. See? Middle. That is IM. As simple as that. Gluteus medius and deltoid common. Yung quick.
Tiga, tiga.
Deltoid muscle is the one nasa braso.
Dito.
Yang dito, ang tawag dyan ay deltoid. No, lagyan nyo dyan. Braso. Yan si deltoid.
Braso ni Mercedes.
Yan, directly into the muscle. Gluteus medius, yan yung sa puwet. Yan yung sa puwet.
Lotus.
Ang gloto.
Braso. The same advantages and disadvantages. Is, kaya lang nakakapatay agad sa sobrang silis. Balik.
Ito yan. Yung Bluetooth.
Pain in the injection site.
Sa botok, sa puwet.
So page 44, disadvantages. Injection site pain. The amount of drug administered has to be adjusted according to the mass of the muscle available. Mahirap yan pag sobrang payat. Pag sobrang payat, konti lang yung muscle. So yung needle, hindi pwedeng sobrang mahaba. Kasi pag sobrang mahaba, na baka mabalik pa lumakas sa buhok. So that's why the nurse adjusts the needle depende sa katawan ng ini-inject nila. So complications, hematoma, yan na yung magkakabuses siya, hematoma. Abscess siya, may abscess siya yung parang cyst kasi sa kaka-inject. Peripheral nerve injury, kasi pag natamaan ang nerve, injured. Kaya may sugat kami kung saan i-inject, hindi kahit saan. Puncture of a blood vessel leading to inadvertent intravascular administration. So yun, hindi kami pwedeng mag-inject kung nakatama kami ng nerve. That's why when we notice, when we inject IM, we have to withdraw first. We withdraw first, clear, inject. That's how we do. But IM is lower than IV kasi dadaan pa siya sa muscle. Sub-Q. Ito na yung pwede kayo, pero pwede lang kayo sa pen, insulin pen. Subcutaneous, yung sa mga taba-taba. Yung sinabi, hindi na lang ako ng ano. Pagka-work ka na, sobrang hurtful pa. Gusto ko lang maintindihan nyo, basta sa may fats area, yung before the muscle, yan si sub-Q. Kaya yung needle ni nurse, hindi siya parang dark, kaya slanting. Kasi hindi siya pwedeng pumunta sa muscle, sub-Q lang kailangan niya sa ibabaw. Kaya slanting. Pwera na lang kung ang needle ay maliit. Sobrang liit at sobrang healthy si pasyente. Ang kapal ng fat. So hindi niya na-slanting. Direkta na. Like insulin pens. Hindi mo na-slanting sa insulin pens kasi ang liit ng needle niya. Straight na siya. What I'm trying to say is yung may syringe, yung needle na i-attach sa taas yung slanting most of the time pag sub-Q. Pero pag insulin pens, kasi maliit lang siya, at pipigain mo yung tiyan, most of the time, ang tiyan talaga may mga bills dyan, ganyan. So you don't have to do slanting, just press. Sub-Q yan. Subcutaneous tissue. Can be self-administered, yung mga matatapang, yung ibang patient, they just do the insulin pens by themselves. So if they can do by themselves, you can do it also. So low risk siya kasi hindi siya kagaya sa IV, hindi siya kagaya sa IM. Mas matagal siya kasi nasa ibabaw pa siya. So it takes time for it to go down. Kaya safer siya compared sa IV na direkta talaga sa ugat at sa IM na sa muscle. Disadvantages, the rate of absorption is difficult to control, hindi mo naman talaga makakontrol. Local complications, irritation, and pain. That's why when you inject insulin to your patient, do not inject in one place. Round. Different place. Okay? Hindi pwede, dyan na lang parati, kasi dyan ka pupunta, dyan ka sure. Wrong. You have to change. So you see the needle in the drawing in page 45. Saan lang si sub-Q? Saan si IM? Saan si IV? In the drawing, you can see.
Yung ayaw mo malalim,
Mas maraming dyan. Intramuscular. Malalaki lang naman sa bukas.
Okay. So next, other routes of medication. By the way, the gauge of the needle, the bigger the gauge, the number of the needle, the smaller the needle. Pag sinabi niyang gauge 18, matakot ka. Napakalaki niyan. That is intended for surgery and for blood test. Blood test na blood transfusion. Bakit kailangan? Of course, when you do blood transfusion, you need a big needle. Kasi mag-blood clot. Pag sinabing 18, malaki yan. Pag sinabing 24, 26, for baby, small yan. Opposite ang needle sizes. I just inform you that. Aside from the size of the needle, makikita mo yung dalawang, yung parang tama sa ibabaw, yung dalawa. 1/2, may dalawa sa ibabaw. When you read the needle,